Hey guys, hi, welcome to Unacademy. This is Unacademy Future Doctors, and I am your educator for biochemistry, Dr. Shivangi Shukla. Happy Republic Day to all of you. Let me just check if I'm visible and audible to all of you. I'll just check if the live stream has started or not, and then I'll continue. Just give me a second. Okay, so I'm visible to all of you, right? Yeah. All right. So this is the two questions per day series that is going on, and this is the 13th session. So every day I have been taking these sessions, two questions per day. We are taking up two questions in each session, and we are going back to the theory part. All the questions are from diverse topics, different topics, and then we go back to the theory part and we cover up a major chunk of the theory in a retrograde manner. So first of all, we discuss the question. So this kind of a retrograde revision is fun and it tends to break the monotony. Okay, so that is my motive, because every month, the last week of the month, I keep for revision. So this is what we have done here in this week. I have kept this for revision, where I'm taking up questions and MCQs, and you're answering the MCQs, and then we are discussing that in the chat section. Okay, and we're discussing the correct answer. You'll answer in the chat section, and then we'll be discussing in the theory part. Okay, so I'm your educator for biochemistry. I'm Dr. Shivangi Shukla. We meet here on Unacademy Future Doctors on YouTube as well as on the Unacademy app. Daily, I'm taking the MCQ sessions called MBBS, that is MCQ bonus biochemistry sessions there as well. And I have completed the medical marathon where we discussed metabolism of biomolecules. Now, I'll just quickly take you through the different types of subscriptions for NEET PG that are available on Unacademy. The Plus as well as the Iconic subscription, both will give you access to video lectures from top educators across the country, live as well as recorded lectures, printed PDF notes from various educators, as well as access to question bank containing a lot of questions. Also, you can access these while on the go on any device of your choice. Okay, and the Iconic subscription will additionally give you resources from Prep Ladder as well. Okay, and to avail an additional 10% discount, you have to put in the educator code DRSHUKLA Dr. Shukla. Okay, DRSHUKLA Dr. Shukla will fetch you an additional 10% off. Also, Unacademy has come up with the Republic Day special offer on the occasion of our 73rd Republic Day. On the occasion of our 73rd Republic Day, Unacademy is offering you 6 months free extension on any Plus subscription of 12 months or more duration. Okay. So, and on top of that, you can put in the educator code DRSHUKLA Dr. Shukla, so that 1 year subscription for you're paying for just 1 year and you're getting 18 months or 1.5 year subscription, and that too at 10% off. Okay, by putting in the educator code DRSHUKLA Dr. Shukla. Okay, got it? So now let us begin with our session. Okay, we have completed so many questions. Let us quickly move on to the question which we need to start here. Okay, so this is the question for today. The first question, okay, you have to answer only in the chat section. Okay, hi Jatin, hello. Okay, so happy Republic Day. So now this is the question. What is the product of complete beta oxidation of 27 carbon containing fatty acid molecule? Is it A, 12 acetyl CoA and 1 propionyl CoA, B, 13 acetyl CoA and 1 methyl CoA, C, 13 acetyl CoA, or D, 27 acetyl CoA? Okay, so your time starts now. 5 minutes for you to answer. Your time has started. Try and answer this question. This is from the topic of beta oxidation of fatty acids, which we have discussed quite a lot of times. Try and answer this, okay? Come on, everyone, try and answer. Not very difficult. You need to have some amount of knowledge about beta oxidation of fatty acids. Then you can answer. Yesterday, Jatin was on the winning spree. He was giving correct answers for all the questions that I discussed, all the sessions. Let us see if he can continue his winning charm tonight or not. All of you are attending. Try and answer. You should not be hesitant in answering, even if you're not sure of your answer. At least try it out. Try and recall what we discussed during beta oxidation of fatty acids. Try and recall that. Okay, Jatin is saying D. Three minutes are left now. 3 minutes for you guys to answer. All of you, try it out. Try this. What is the product of complete beta oxidation of 27 carbon containing fatty acid? A. 12 acetyl CoA and 1 propanol CoA. B. 13 acetyl CoA and 1 methyl CoA. C. 13 acetyl CoA or D. 27 acetyl CoA. Okay. Come on, try and answer, guys. Everyone, do try and answer. Twenty-seven carbon containing fatty acid molecule. Okay, this fatty acid has odd number of carbons. This is a hint that I'm giving you. Odd number of carbons this fatty acid molecule has. Come on, everyone who have read about beta oxidation in your first professional examination should know this. It is important. This concept is an important concept. Okay, last 1 minute left now. Yeah, last 1 minute left. All of you, all those who want to venture with the guests, or those who want to venture with excuse me, venture with what you have deciphered, you can now is the time to do it. Just 1 minute left for you to answer. It is a very important concept. Now I'm happy that I'll be able to clear this concept here with the help of this MCQ, because I have taught this also But I think while teaching, while just during the theoretical class, much of the things escape our attention. Okay, because we have a lot to study. So that is why it is better if we choose important concepts through MCQs and then we revise. By that, what happens is if we attempt an MCQ, then that thing stays in our mind for a long time. Okay, so that is why I'm coming up with these MCQs. Okay, so now I'll tell you the answer. The answer is A, 12 acetyl CoA and 1 propionyl CoA. Okay, and why is this so? See, during beta oxidation of fatty acids, what happens is the fatty acid molecule is cleaved successively after every 2 carbons to form 2 carbon containing acetyl CoA molecules. Okay, this is so for for even number of carbon containing fatty acids. So if a fatty acid molecule has 12 carbons, or say if it has 26 carbons, okay, so it will produce how many acetyl CoA? 2, 2, 2, 2, 2, 2. So 26 divided by 2. That means it is going to produce 13 acetyl CoA molecules. Okay, 26 divided by 2, because it is going to be cleaved successively into 2 carbon containing molecules. Okay, so it is going to form 13 acetyl CoA molecules. But what about an odd number of carbon containing fatty acid chain? Suppose it is this one, 27 carbon containing fatty acid. It will be cleaved in 2, 2, 2, 2 until just one molecule is left. Okay, so what about that molecule? So to prevent that, what the body does is, the body will first take out a 3 carbon containing compound, that is propionyl CoA. So one propionyl CoA containing 3 carbons is removed. Okay. So now what is left? 27 minus 3 is 24. These 24 carbons are now what? Even number. So these 24 carbons are then successively broken down into 2 carbon containing acetyl CoA. 24 divided by 2 will give 12. So 12 acetyl CoA and 1 propionyl CoA. This is true for every odd number of carbon containing fatty acid. 1 propionyl CoA will remove, converting it into an even number, and that can be divided by 2 to reveal the amount of acetyl CoA that is formed. Always remember this concept, okay? Beta oxidation is what? Successive cleavage of fatty acids into 2 carbon containing acetyl CoA molecules. What is beta oxidation? It involves the beta carbon. That is why it is called beta oxidation. And why oxidation? Because why is it oxidation? Because hydrogen is getting lost. Okay, hydrogen is getting lost, so therefore it is oxidation. Okay, this is oxidation that is happening here. FADH2 and NADH2 molecules are produced. Okay, and what is the enzyme? Acyl CoA dehydrogenase. Where is this acyl CoA coming from? The fatty acid molecule gets, the first step in beta oxidation is the activation of fatty acid. The fatty acid molecule is activated into acyl CoA by the enzyme acyl CoA synthetase outside the mitochondria in the cytosol. Now this acyl CoA can freely cross the outer mitochondrial membrane, but the inner mitochondrial membrane it cannot freely cross. Therefore, it is transported by the carnitine transporter inside the mitochondrial membrane. When it enters the mitochondrial membrane, it is acted upon by which enzyme? Acyl CoA dehydrogenase to form what? Acetyl CoA molecules. Okay. And if it is an odd number of carbon containing fatty acid, 1 propionyl CoA and n minus 3 by 2 acetyl CoA molecules. Okay. And where will these acetyl CoA molecules go? They will go into the citric acid cycle or the Krebs cycle to connect the fatty acid cycle with which cycle? With the carbohydrate metabolism. Understood this or not? Understood this? Next what we are going to read is, what we are going to study. Let me take up a different question. Okay, this one. Which of the following collagen subtypes has a meshwork arrangement? Which of the following collagen subtypes has a meshwork arrangement? Okay. Is it A type 1, B type 2, C type 3 or D type 4? Alright. Okay, now I'll give you 5 minutes for this. Do try and recall the structure of collagen. We have read that a lot of times. We have discussed the structure of elastin also, and now we are going to discuss the structure of collagen here. Your 5 minutes start now. Try and answer this, okay? Which of the following collagen subtypes has a meshwork arrangement? Type 1, type 2, type 3 or type 4? You have to answer in the comments section. Come on, everyone. This kind of a straightforward question. And the structure of collagen is extremely important for biochemistry. Very, very important, guys. You cannot go ahead without reading the structure of collagen, okay? You cannot make do without this. Come on, everyone. Try and answer this question. Not very difficult, kind of a straightforward question. Good. Jatin has come up with the answer again. It is D according to him. Okay, let us see if he can get this one correct or not. Jatin says type 4 collagen. Now, how many of you agree with him and how many of you want to differ? Let us see. Let us get more answers. You have 2 full minutes now. 2 minutes to come up with the answer. Please recall the structure of collagen. It is highly disappointing to see that there are others who are not sure about the structure of collagen, which we have discussed quite a lot of times. Type Type 1, type 2, type 3, type 4. Which of these collagen subtypes has a meshwork arrangement. Okay, meshwork arrangement is what is being asked. What is the normal structure of collagen? That also you should know. And where is this meshwork or network type of structure present? Come on. Come on, last 1 minute left. Last 1 minute left for you to answer. Come on, guys. Try and answer this. 30 seconds left now. 30 seconds left for you to answer. Type 1, type 2, type 3 or type 4. Meshwork arrangement of collagen. Okay, so now shall I tell the answer? Let me just check if the time has been completed. Yeah. Okay, so the correct answer here is very good, Jatin. Congratulations. Again, I'm very proud of you. It is type 4 collagen D. D type 4. This is the correct answer. Okay. Now, all of you, I'll tell you what is the structure of collagen. All right. The structure of collagen is a triple helix. What is the meaning of triple helix? There are 3 alpha helices. Now, these 3 alpha helices are left-handed. Okay. They are left-handed. And the suprastructure of collagen is right-handed. So if you try to unwind this, if you try to unwind collagen from outside, the inner chains will get even tightly wound up together. Okay, the inner chains get tightly wound up together. So the opposite handedness will prevent the unwinding of the collagen structure. Okay. So this is how the 3 alpha helices are arranged. Okay. And this rod-like structure of collagen is called the fibrillar structure. Okay. It gives strength and stability to wherever collagen is present. The fibril, collagen fibril. And what is the what is the characteristic of this fibril? Every third amino acid is glycine. And why is it so? Why is it so? Can you guys tell me? Why is every third amino acid here glycine? Because glycine is the smallest amino acid. Okay, it is the smallest amino acid. So it is going to, the fibril is very tightly packed together. Okay, all these amino acids are very tightly packed together. So there is very little space for this to go inside, for the amino acid to go inside. So only the smallest amino acid can fit in. Therefore, every third amino acid is glycine here. Now, what are the other residues? So this is the structure. Okay, per chain there are almost 1000 amino acids. So see, can you see how very tightly packed it must be? It contains almost 1000 amino acids per chain. Okay, and per one turn, that means one pitch. Okay, one pitch has 3.3 residues per turn. Okay, and what is the diameter of the fibril? The diameter of the fibril is 1.4 nanometers. Okay, now it is GlyXY, GlyXY, GlyXY. What does this mean? That X and Y can be other amino acids, but every third amino acid is a glycine. Okay. Now, the other most important amino acids are the proline, hydroxyproline, lysine and hydroxylysine residues. Now, proline is an amino acid. Okay, proline will be hydroxylated by the enzyme prolyl hydroxylase in the presence of vitamin C and alpha ketoglutarate to form hydroxyproline residues. Okay. Now, in the absence of vitamin C, in the deficiency of vitamin C in scurvy, what happens is these hydroxyprolyl and hydroxylysyl residues are not formed. Therefore, what happens is defective collagen. Collagen is unstable. The collagen cannot be stable. And what happens is the connective tissue is also defective and it leads to easy bruisability and delayed wound healing. Lysine can be hydroxylated similarly by lysyl hydroxylase into hydroxylysine in the presence of vitamin C and alpha ketoglutarate as cofactors. Okay. And there are also, similarly in scurvy, hydroxylysine will also not be produced, and what will happen? The stability to the collagen structure will not be there, and what will happen? The connective tissue that is synthesized will be defective. Understood? Now, yeah, one thing is very, very important here, that collagen has glycosylated hydroxylysyl residues also. That means glycosylated means carbohydrate moiety is attached. So if a carbohydrate moiety is attached, what does this mean? This means it is a glycoprotein. Okay. Now this glycosylation is occurring via O-glycosidic linkage. What is this O-glycosidic linkage? This means that the O atom, the oxygen atom of hydroxylysine is getting glycosylated by the sugar. The sugar is either glucose or galactose. Have you heard of the beta N glycosidic linkage somewhere? Can anyone tell me where you have heard of beta N glycosidic linkage? That means the sugar gets attached to the N atom, the nitrogen atom. Have you heard of this linkage? We have discussed this, I'm telling you, yesterday or day before yesterday, we have discussed this in this 2 questions per day series only. The beta N glycosidic linkage. Come on, I'm waiting for your answer. Tell me. The glycosidic linkage between the sugar and the nitrogen atom. Here the glycosidic linkage is between the sugar and the oxygen atom of hydroxylysine residue. Okay, the sugar is glucose or galactose that gets linked, that gets attached to the oxygen atom of hydroxylysyl. But there is some glycosidic linkage where the linkage is between the ribose or deoxyribose sugar and the N or the nitrogen atom. Where is it so? No, Jatin, it is not heme. No, heme, the glycosidic linkage is not at nitrogen, it is from the carbon atom. Okay, alpha methylene bridges, they are at the carbon atom. Okay, they are from the carbon atom, glycosidic linkages. And plus, the heme atom is not, it does not have sugar residues. Okay, the heme atom, the tetrapyrrole chain that you are saying, that has the methylene bridges. It is not the glycosidic linkage, it is the methylene bridges that we have read. The 4 tetrapyrrole chain, the 4 tetrapyrrole, cyclic tetrapyrrole, it has alpha methylene bridges. Okay, methylene bridges, that means carbon atom is involved. Glycosidic is wherever carbohydrate is involved. So the N-nitrogen carbohydrate that I am talking about is the N-glycosidic linkage is there in DNA, in nucleoside. Nucleoside is what? Nitrogenous base plus sugar on the side, nucleoside. So nitrogenous base plus sugar is nucleoside, which has beta N-glycosidic linkage, where the beta carbon of the sugar, ribose or deoxyribose, and the N atom of the purine or pyrimidine, nitrogen atom. Okay, very important. We have just recently discussed. Okay, next. Also, so what all are present? Proline, glycine, proline, hydroxyproline, lysine, hydroxylysine, glycosylated hydroxylysine, and lysine is also oxidatively deaminated to form aldehyde. Okay, by which enzyme? Lysyl oxidase enzyme. There is an, here which enzyme was there? Hydroxylase enzyme. Okay. Now there is an enzyme called lysyl oxidase enzyme, which oxidatively deaminates, means removes the amino part to form the aldehyde. Okay, now these are modified lysyl residues and they will combine together to form interchain and intrachain covalent cross links. And these are the main contributors of the stability of collagen, these cross links. This lysyl oxidase enzyme is dependent upon copper. Okay, so therefore during the deficiency of copper in Menkes disease, what happens is this lysyl oxidase cannot function properly and these cross links are not formed. So therefore the stability, the inter and intra-chain stability of collagen is decreased. Okay, this lysyl oxidase is also present in elastin also. So elastin is also affected in Menkes disease. Now, the normal fibrillar structure of collagen has the quarter staggered alignment where each collagen fibril is not present one after the other like this. It is not present like this. Rather, it is present like this. Okay, understood? Each collagen fibril is not present like this. No, it is present like this. Okay, so it is staggered. Staggered means it is displaced. Okay, it is staggering by 1/4 of its length. That is 1/4 means 1/4. So it is called quarter staggered alignment of collagen. Okay, and this is what gives the collagen its banded appearance. So this is the fibrillar structure, the rod-like structure. Now what happens is in type 4 basement membrane, type 4 collagen forms part of the basement membrane. Basement membrane filters substances. So here it needs to have a meshwork or a network like structure. What is this structure like? Imagine the mosquito nets, machardani. The mosquito net that is there, it has small holes which are connected by the threads. So that is the meshwork structure of collagen. Okay, it is like the mosquito net. The holes represent the portions where the GlyXY unit is absent. It is deficient. So that is a hole. And the threads represent the fibrils that are present. Okay, so the fibrils will be connected together and at some places there will be absence of the GlyXY structure and those will be holes. And those holes will form the meshwork structure of collagen. Understood this? So this was all for collagen, the structure of collagen that we revised here. Now, okay, so thank you all of you for this, for being interactive in the session. And you can go back and revise this and the other sessions of 2 questions per day. Okay, and do attend tonight's session on Unacademy special classes at 10:15 and at 11:15, 2 classes on MBBS, that is MCQ bonus biochemistry sessions. Okay, all right, do attend that and we'll be seeing you. Okay, all right then, thank you guys, bye bye. If you haven't subscribed to this channel, then do subscribe to it for regular updates and notifications, and also you can come up with any feedback and any suggestions as to what are the other topics on which you want to have classes. And do share this also amongst your friends so that we get better visibility and more students come and join in the sessions. Okay, all right, bye bye.